Ladies and gentlemen, Mayor Brown, Judge Eccles, chiefs, fire chief, police chief, distinguished members of the Texas medical community, members of the press, welcome to the Baker Institute. September 11th, 2001 is a turning point in the history of the United States with significant domestic and foreign policy implications. I just returned from a week of consultations in Washington last week, and it is evident that in the wake of the terrorist attacks in our country on September 11th, that our society and government at every level, federal, state, county, municipal, is seized with the urgent task of enhancing our individual and collective defense against terrorism. The most effective coordination between and amongst agencies and the proper assignment of resources, material and manpower, are urgent priorities throughout our land. Houston is no exception to this basic challenge. Approximately 2 years ago, Mayor Brown and I agreed that the Baker Institute, in its public policy role and as a service to the Houston community, would undertake an independent assessment of the City of Houston's response mechanisms in the event of a terrorist attack. So we've been at this for a while. By mutual consent, the assessment's focus is solely on response mechanisms because counterterrorism measures are highly classified and remain predominantly in the hands of the federal authorities and the intelligence agencies. The Houston Task Force on Terrorism is evolving into a collaboration of local, county, state, and federal agencies. The City of Houston, obviously, the medical community, which we have distinguished representatives here, including the Houston Medical Strike Team and the Harris County Hospital District. Our institute, the Baker Institute, is part of this effort. In past years, various components of the task force have been planning ways to prepare Houston to respond to terrorist threats and acts. The Houston Task Force on Terrorism is enhancing its efforts after the terrorist attacks that occurred on September 11th. The assessment has taken a ground zero approach to the task of analyzing and assessing the needs of the community. In this approach, we look at the response chronologically from first report of an event to first response to the request by the city for outside resources. Thus, the assessment has been laid out in 3 phases. The first phase is to summarize the municipal response to an event and to verify the response procedures in place for various city departments and for calling in additional assistance. Once the city's mechanisms have been summarized, the resource and capabilities to be called upon from the state and national level will be integrated. The second phase is to focus on the government, public-private interface of the response, particularly in the areas of medicine, hazmat, and law. The third phase is to undertake a dual-focused education program to educate the public and to assist in providing scenario workshops for community leaders and other participants if so desired. After a year of research, we have the draft of the summary on the city's response mechanisms, and we are continuing our work on the other phases in an accelerated manner, especially after September 11th. Now, our findings to date in summary are the city's departments have put significant thought and effort into their emergency plans. A large number of personnel have been trained and or participated in exercises to deal with various events a first responder might address. The city has accomplished a significant amount with the resources that have been available. To the extent there are shortcomings, they are the result of insufficient funding within the city's budget and insufficient resources received by and from the state and federal government. And frankly, they are similar to the problems experienced in other large metropolitan areas of the country. In Houston, the citizens are better protected than most because of years of experience with an industrial base has presented the risk of a chemical incident or major explosion. And our experience with hurricanes has resulted in evacuation plans for large portions of the population. The City of Houston continues to refine its plans and preparations for a terrorist incident in cooperation with local, county, state, and federal authorities. Since 1997, first responders have received specialized training from the Department of Defense and the United States Public Health Service, and a comprehensive medical response system has been created. The system is comprised of the medical community, receiving hospitals, the mental health community, public health officials, first responders, the Houston Medical Strike Team, and governmental agencies at the local, state, and federal levels. Examples of initiatives by these parties include distribution with the assistance of the Harris County Medical Society of educational materials to speed the recognition of chemical and biological agents, as well as training courses and planning templates produced by the Hospital Working Group. As a result of the events of September 11th, planning efforts have been accelerated to maximize readiness, and the Houston Medical Strike Team will be training on a more frequent basis. For the best response to an incident, the responders, both governmental and non-governmental, must be trained, have adequate equipment and supplies, and regularly use their training in their daily work or regular exercises. The city's responders must know on whom they can call for support, the time required for support to arrive, and the mechanics of coordination. These phases at every level of government need sufficient funding and sufficient manpower levels. The assessment will attempt to identify the resources and funding required, and this is very important, to identify the resources, funding required by Houston's governmental and non-governmental organizations for a thorough and coordinated response within the city, as well as the support anticipated from state and federal agencies. So this is what we are about. I would now like to call on Mayor Brown to make some remarks. Mayor Barron.
Thank you, Ambassador. Let me thank all of you for coming out today as well. We believe it's important we update our community on where we are and being prepared for anything that might happen. As the Ambassador indicated, this is something that's been going on for some time, but obviously as a result of the 11th of September, our world changed for all of us, those who are involved in the assessment, those who are involved in carrying out any plans. As you may know, I served as the senior scholar here at the Baker Institute prior to running for mayor. At that time, the ambassador and I were discussing this as an issue. And when I was elected to the position of mayor, we then put into place that which we were talking about. So for over 2 years, we've been doing the assessment of Houston's preparedness for any particular terrorist attack, be it chemical, biological, or nuclear. And that's what he described to you in detail. I won't go into those details. What is important for us is that the City of Houston, in cooperation with other local, county, state, and federal authorities, as well as our medical community, continues to actively plan and prepare for any possible incident. It has to be an ongoing process, which includes also the training that's taking place now, particularly through the Houston Medical Strike Force. This dialogue clearly increases our preparedness and actually helps us in terms of the practical aspect of a plan. A plan's one thing, but implementation becomes another, and what's being done here at the Baker Institute assists us greatly. And I'm glad that we've returned here to the Baker Institute today to update you on Houston's accelerated efforts to make sure that we're prepared as a result of what occurred on September the 11th. We do have a multifaceted response in the event of any type of terrorist attack. I'm also very pleased that when I asked him, Dr. Feigin readily agreed to join the task force and to represent the medical community. As could be expected, the medical community plays an extremely important part in anything that might happen. I'm also very pleased that Judge Echols is very much a part too in terms of the county. Judge Echols' role is extremely important, and he's very much a part of what we're doing here as well. So our being here today basically is to update you, let you know that There are a lot of things that have been going on, but as a result of the 11th of September, we have to escalate everything to make sure that we are prepared. What do we need? If there are any voids, do what's necessary to fill the void, whether it's in planning, whether it's in the plan, whether it's in equipment, all that has to be taken care of. And I want to express my sincere thanks to Rice University, the Baker Institute specifically, and Ambassador Djerejian also for the leadership that you're taking in this issue. We can all take some comfort in knowing that we have the Baker Institute, a relatively new institution in our city, but it's gone a long ways in establishing itself as a major public policy entity here in America that's probably second to none any place in the world. And that occurred because of the great leadership that Ambassador Djerejian has given to this Baker Institute. And I want to again thank you for taking on this project, because indeed you do a great service for our entire community. With that, I'm going to ask Judge Echols to come and make his comments. He'll be followed by Dr. Feigin.
Mayor, and I am, again, pleased to be here today to answer questions and tell a little bit about Harris County's role in what we are doing in the preparation for possible terrorist attacks in our community. On our website, you have available, and I'll tell us for the media particularly, if you want to look at it and see things, a terrorist incident response report. This report was prepared as part of our basic plan as a routine for the management of the emergency operations in Harris County. And it outlines very clearly what we would be doing if the county and the city has a similar program and they're in place for them for emergency response. And I'll leave this here, one copy here for y'all if you want it as we get finished and have folks available to answer about incident response. It is part of the planning process out of our Emergency Operations Center at the Harris County Office of Emergency Management. Again, as we get through today for questions, Frank Gutierrez is here from the Emergency Management Office. Our director, Jim White, has been called to New York City and is helping reestablish their office there. Most of their personnel were lost in the collapse of the World Trade Centers after the attack on the 11th. We are pleased and proud that he was invited up to take our expertise and experience to New York as they reestablish that office. More importantly, we are excited to have the prospects of bringing back the experiences they gained there that we can apply here. Regionally, we have worked through the Gulf Coast Emergency Management Association. We have already had meetings after the attack. Again, Frank, our Emergency Management Office, has been there. Our Fire and Emergency Service folks have been there, as well as representatives from the City of Houston and other jurisdictions, on how we coordinate not just within Harris County and the City of Houston, but throughout the Upper Texas coast. In our office, we're looking particularly at the rail safety issues and the chemical plants as those travel through the cities and the unincorporated areas of our community. Again, a terrorist attack is not unlike, as the ambassador mentioned earlier, a major chemical incident or plant explosion. In our response to those activities, it is still largely a similar type of event. Harris County's Fire and Emergency Service operations are assisting regional fire departments with training. Those regional departments are largely volunteer organizations, and we will go in and help and assist those first responders, again, drawing on resources and experiences we've had through the city's hazmat team operations and our operations to try to prepare them for these potential threats to our community, and we'll continue to provide that support role. We know we need to improve some of the communications issues. We know we need to look at a better response in terms of massive attacks. We have a plan in place, but the mayor mentioned, the ambassador mentioned, I'm sure the doctor will mention the things they're doing to sharpen the skills of our response in the medical community. And we learned some lessons in Tropical Storm Allison about the ability of our community to respond in the event of a major impact on our trauma centers. We know that having everything together at the medical center and the access issues for flooding could also apply in the event of a terrorist attack, and we need to be working on planning of how we better deliver healthcare services on a broad scale in the event of a major event, be it terrorist or natural disaster. We are excited to be a part of the program in Harris County. The city has been a very active partner with us. It started with the TranStar operations 5 years ago, I guess now, Mayor. And Mayor Brown has been an excellent partner through his operations centers and working with the state and federal agencies as well. will continue to be available and continue the cooperative efforts that you've seen in the past as we look at the new threats facing our community today. With that, Doctor, I'll ask Dr. Feigin to come up and he'll tell you about the medical response.
As has already been indicated, concerns regarding the possibility of biological, chemical, or for that matter, terrorism with nuclear agents has been heightened as a result of the attacks that occurred September 11th of this year. Even the most conservative of experts have been really reassessing the plausibility of a major biological or chemical attack somewhere in the United States. Now, although biological weapons pose a great potential risk, they are in fact somewhat more difficult than chemical agents to deploy. They require a little bit more sophistication to do so than has sometimes been indicated. Houston, as the ambassador has already stated, is probably better prepared than most major cities for such an event. Nevertheless, no one can ever really be truly prepared sufficiently for a chemical or biological attack, not at least to the extent that they would like to be. The potential agents that could be deployed and the timing of the attack will, of course, not be known. We know what type of agents can be used, but the agent actually deployed will not be known until it actually is used. With many biological agents, the first cases may not appear until a number of days after the attack has actually already occurred. Patients who are affected may show up not just in Texas Medical Center hospitals, but in hospitals throughout the city and county and perhaps surrounding counties. And therefore, the kind of collaboration and cooperation between the city and the county and state and federal agencies, of course, is extremely important. It will be critical for every physician, an allied healthcare worker, as well as every hospital, to have the requisite education to ensure that diseases such as those that have already been talked about in the press, like anthrax and botulism and tularemia, smallpox and others, are considered when clinically relevant symptoms actually appear. These healthcare workers must become familiar as well with the appropriate diagnostic tests to establish an effective diagnosis rapidly and obviously the most effective treatment modalities. Hospital personnel in the Texas Medical Center and throughout the region will require additional training to respond appropriately to bioterrorist activities, and they will need to familiarize themselves further with the most appropriate method for actually handling patients who may have been exposed to or contaminated with chemical or radioactive materials. There has been training in this area, but much more training will obviously need to occur. Coordination in the response between the City of Houston strike team and hospital emergency personnel will obviously be essential, and some of that training and coordination has already occurred. The requisite equipment and supplies will need to be stocked and in place in many different areas. The appropriate procedures to triage patients within hospitals, which we already have for many types of disaster, will have to be again reviewed and updated with regard to these issues, and a specific plan to decant less acutely ill patients from Texas Medical Center hospitals to other peripheral hospitals will be required, and we certainly had experience with that during Tropical Storm Allison. Education of the lay public with regard to a realistic assessment of risk. And I'm going to emphasize realistic assessment of risk because I've read a lot in the papers recently and seen a lot on TV where some of the things spoken about are honestly somewhat unrealistic and have created a sense of panic that shouldn't be there. You can't confront events like this with panic or fear. You have to confront them with education and training. Finally, coordination with the City of Houston Health Department will have to be absolutely perfect. And we have wonderful relationships between the City of Houston Health Department, the Harris County Health Department currently, and the medical community. It is important that physicians and other allied health personnel ensure that every patient with a reportable infectious disease, and I might say all of these agents are reportable infectious diseases, would be reported immediately to the health department, and that's going to have to be emphasized to every physician in the community, because that's the only way an outbreak can be defined and identified as quickly as possible. Veterinarians will also be involved in reporting unusual illnesses or deaths in a variety of animal species, because, of course, they may be the sentinel animals that might predict, in fact, the occurrence of an event in people. Now, we're fortunate that in Houston, we do have many individuals with expertise in all of these areas and who have agreed to serve on an advisory committee to the city to ensure that any response will be both prompt and effective. Included among the areas that the advisory team will be considering, and areas that I deem to be of great importance, will be the development and dissemination of appropriate educational material, both for physicians and the lay public, so that everyone is quite familiar with the types of disorders and what can be done about them. Now, what I'm going to do as I conclude is announce the Medical Advisory Steering Committee membership to the City of Houston strike team. And at the request of the mayor, I'm going to serve as chair of that committee. And I'd like to emphasize at the outset that although the members that I announce here are going to serve as sort of an executive group and steering committee, that we will be enlisting many, many other healthcare professionals who we have already spoken with and who have tremendous expertise in infectious diseases and chemical issues and radioactive issues, things of that type. So even though I announced some of these names today, this is just an executive steering group. There is far more expertise available in the community that we will be tapping and that we've already received assurances from in terms of individuals who will be working with us and cooperating with us. The steering committee in alphabetical order that's going to be working with me will be as follows. S. Ward Cassels, who is Professor of Medicine and Vice President for Biotechnology at the University of Texas Health Science Center in Houston. James H. Red Duke, Jr., Professor of Surgery, University of Texas Health Science Center in Houston. Herbert L. DuPont, Chief of Internal Medicine at the St. Luke's Episcopal Hospital. Bert, in particular, is an infectious disease specialist, as I am. Stephen Greenberg, an Associate Chairman, Department of Medicine, Baylor College of Medicine, Chief of the Medicine Service at the Ben Taub General Hospital, also a specialist in infectious diseases. Carlos Hamilton, Vice President and Special Advisor to the President of the University of Health Science Center at Houston. Kenneth L. Maddox, Professor and Vice Chairman, Department of Surgery, Baylor College of Medicine, and Chief of Staff of the Ben Taub General Hospital. As you know, both Dr. Maddox and Dr. Duke together are renowned individuals in emergency medicine and trauma care. John Mendelson, President of the MD Anderson Cancer Center. Edward Septimus, Medical Director of Infectious Diseases and Occupational Health and Pharmacy for the Memorial Healthcare System. Jeffrey Stark, an Associate Professor of Pediatrics at Baylor College of Medicine and Chief of Pediatrics at the Ben Taub General Hospital. Dr. Stark is also an infectious disease specialist and represents the United States to the World Health Organization on selected infectious disease issues. James Willison, President of the University of Texas Health Science Center. As I want to indicate again and emphasize, this is just the executive group. There are many other healthcare professionals with expertise in infectious diseases and handling of chemical agents and handling of radioactive materials that will be working with us. And I'm going to conclude my remarks and turn it back over to Ambassador Djerejian.
I must comment how fortunate we are to have such great medical expertise in the city of Houston to help us in this effort. I am now going to open the floor for questions from the press, and we have the experts here to answer any questions as appropriate. So, first question. Oh, I'm sorry. Please raise your hand and have a microphone in front of you so we could hear the question and have it recorded for posterity.
I don't know who to best address this to, but have you determined what are the most likely scenarios, and can you talk about those? Yes, sir.
I'll tell you what, if you want,
What form of attack would most likely occur?
I don't think that I'd like to give you, to be honest with you, a very specific response to that, because some of the information that I personally have would, if I were to just describe this to you, would obviously perhaps cause individuals who wish to do harm for the city or state or nation, just tell them basically what to do, so we won't do that. I would make the comment that there are a variety of biological agents and chemical agents that have already been described by the press that are well known, agents like anthrax and botulism and tularemia, and chemical agents like sarin and other nerve gas-like agents, where various cult groups or terrorist groups have attempted, sometimes successfully and sometimes more often unsuccessfully, to use them in the past. So obviously, they would be agents that would have to be highly considered.
Excuse me, we're having problems with the audio. Can you speak on that?
Surely.
sure. Okay.
I'm Bob Boudreau with Channel 13 here in Houston. Two questions. First of all, the Secretary of Health and Human Services said that we have an adequate supply of antidote, for lack of a better term. Has the supply of antidote been compromised in Houston by a result of the flood that took place in the medical center?
I'm not quite certain what you're referring to, because the word antidote just means something that you can use to
Say for anthrax.
Well, for anthrax, candidly, the best available, what you're calling antidote, would be immediately, if you knew this after exposure, to use a drug like ciprofloxacin, which might prevent the disease. There is, of course, as is well known, an anthrax vaccine. That vaccine during the Gulf War was actively used for the troops that we sent to the Gulf area. The efficacy of that vaccine is only really known from experimental studies, and of course, in a known event, it's hard to know what the actual efficacy would be.
Second question, everything I'm hearing here is reactive to a possible assault. What's being done on the preventative side? Can anybody address that?
Into surveillance.
There's a lot being done throughout America on the preventative side, and certainly here, we're part of the anti-terrorist task force that's headed by the FBI. We have Houston police officers as part of that task force and other law enforcement agencies. Their basic function in this regard is to gather intelligence information that comes from all over, make some sense out of what it means, and then prevent something from happening. I can tell you firsthand from a federal perspective that many potential terrorist acts have been prevented because of the intelligence information. So the most active element here in our area would be the anti-terrorist task force headed by the FBI. They're part of the task force. They're part of the task force. It's not a matter of sharing information. They work shoulder to shoulder, day by day, as part of the task force. That's Houston police officers.
I have a question. Mr. Ambassador, you mentioned that any shortfalls in the first responder system locally are because of funding and some other problems. I'm wondering who can go into those shortfalls and how those are addressed or spelled out in this report. What's being done about them?
Well, basically, the nature of our study is to report our findings to the mayor and to the city. And that effort is now underway, and that will be submitted to the mayor's office. It's not an issue for me to present here publicly at this point.
But you mentioned that those shortfalls are already apparent, and I'm just wondering what concerns have raised themselves thus far and how those will be addressed in any final report.
Well, that's up.
Let us keep in mind The creation of this initiative here, the Houston Task Force, was to look at what we're doing, look at what we should be doing, and then advising the city on any issues that are of concern. And so as we go along, we will receive information. Because of what happened September 11th, this, what we consider to be a long-term endeavor, is put on a fast track. We're not waiting anymore, and if things are identified, they are brought to our attention immediately, and we will take care of it. Obviously, you don't publicize any shortfalls you have. If you have any shortfalls, it doesn't make sense to publicize, so we're not going to say anything about that. You can be assured if there's any issue that needs to be addressed, our objective, or at least our task, will be to address those issues.
Mayor, I'm just going on what he had mentioned earlier. He mentioned that there were shortfalls, and I'm just wondering what needs improvement and how this...
Let me give you one example. On our medical strike force, we had planned a number of exercises off into the year. Well, we're not going to put anything off into the year anymore. We'll do one within the next few days this month. We're doing weekly drills with our police and fire with the equipment. We have already deployed equipment and vehicles strategically throughout the city. Those things are being done as a result of September 11th. I guess that's one example we can give you where we hear something, see something, then we're not going to wait. We're going to act to make sure that we've done everything possible to take care of anything that needs to be taken care of.
To give you an example too, at the county side, again, we can't speak to the city's staffing issues. Harris County is not a first responder for fire. We have arson. I've got a fire and emergency services director here. We have arson investigators. We provide support to municipal departments, City of Houston or others. The city largely does their own, but we have with the other cities in the community, emergency service district, rural fire districts. We have stepped up a training program, and Fred Winnish is sitting right next to you and can tell you about that, for the fire departments on how to respond to these types of incidents within their communities. And we're looking at personnel issues and how we provide better support between those departments to reinforce each other, because they are often volunteer fire departments. Many of those people may be working at a chemical plant where an incident would occur and they wouldn't be able to show up to respond to the fire through the local municipality or volunteer fire department. So we're working on assisting with mutual aid agreements between those departments, having personnel in to help with the training and support to provide better response in the event of an emergency. So those are the kinds of issues that we're looking at the county now to fill gaps that may exist in the community for these kinds of incidents.
My name is Michelle Casas with Fox 26 News. Mr. Mayor, you may have answered this question.
Mr. Microphone?
But I'd like to know what level of training has taken place in the city. Several of these gentlemen that spoke mentioned that Houston is prepared.
We have ongoing training through the police department, through the fire department. That's ongoing. It's not something that happens when there is an incident. The fire department's hazardous team, for example, they're always training. The police departments, their teams are always training. We have periodic training of our Houston medical strike team. And what we've done is to dictate that we will have quarterly training, quarterly drills until further notice. Before it would be, twice a year we do the drills. Now it's quarterly until further notice. On the police and fire side, we're doing weekly training on their equipment to make sure that nothing's left undone. So we're doing that right now. And that's the result of what happened September 11th. Absent September 11th, we'd still probably be doing our 2 drills per year and less frequent training on our equipment. And now we're doing that weekly.
Elizabeth Lee with WB 39 News. 2 questions. First question regarding funding. The ambassador mentioned sufficient funding is very important. Do we have sufficient funding to do all that we need to do as far as training and things that you've mentioned? And do we have to jiggle our budget around, or how's that looking?
Both. We're not going to not do something because of the absence of funding. The stakes are too high. If it's a matter of not having resources to do the training, we'll find the resources someplace within budget. And So we will do what needs to be done. I guess that's the best way to answer your question. Obviously, probably every agency would have some budget constraints, but the number one priority is to make sure we provide for the safety of the citizens, the residents in our city.
Any idea of where that might come from if we have to move our budget around?
If it's from the city government, we would have to look at our general fund budget, which operates most of our departments rather than the airport and the water and the convention bureau, and we would just have to look at how best we can take the funds that are necessary and not completely destroy the services we have to deliver. We've not reached that point. Everything that we need to do right now, we can do within our budget as it exists.
This is a totally, I don't know, Judge Eccles.
At the county level, the first priority is public safety. And if we have to start prioritizing and moving funds, we would start moving funds from the support services into the public safety side. The real challenge is not today. It's the sustaining of the effort for the long term and the public's will to sustain that for the long term. And the challenge for the medical community and others is to develop a plan that doesn't have 10,000 empty beds waiting for an attack that may never happen, but to have in place a system that can adapt to an attack, but in the meantime is affordable and we can use and help the community every day. And an example might be something like the medical examiner's office. And recently we had the case where the bad drugs on the street came into the ME's office. Individually, those cases didn't raise any flags. It was just another drug overdose. The ME caught it at the county, notified the police department within days. The interagency task force with the city, the county, the state, that group went out, found the dealers, got the bad drugs off the street. Now, all drugs are bad, but this particular concoction was deadly on one shot. And so that was a case of the different agencies communicating with each other. The systems worked as it is designed to, and the medical examiner's office, which I think will be one of the first lines of defense in a bioterrorist attack as well, was able to identify these cases coming from various parts of the community with seemingly dissimilar backgrounds into a common thread that was then acted on by law enforcement. And so we'll be doing those same kind of things here and trying to build sustainable operations that not only support terrorist response, but also benefit the community in the long term for other areas as well.
I guess the bottom line is public safety is government's top priority, our first priority. We'll take care of that first and then take care of other things.
That's why we exist.
Maybe a question for the doctors. Is there anything that people can do at home to, protect themselves? Some people are talking about buying gas masks and things like that. Is that something that's, overreacting or something to be considered?
That's a probably more difficult question than the way it was posed. I've seen people go out and, as sort of a knee-jerk reaction, buy a gas mask, and in fact, they don't really know what they're purchasing, because the requirements to inactivate certain kinds of gases or to prevent certain kinds of infectious agents are different one from the other, and you really have to know what is in the canister that is attached to the mask with regard to its ability, for example, to inactivate selected nerve gases as opposed to something like chlorine or nitrogen mustard, or alternatively, whether your mask, for example, has in it a millipore filter that can filter out certain bacterial agents. It's not just going out and buying a mask. So I would say it's an overreaction at this moment, and our team, medical advisory team, will try and define for selected personnel and what really should be required or what might be available, and we will have some recommendations to make for the community.
Pam Easton, the Associated Press. I was wondering, as far as scenarios, since this study began prior to September 11th, have you come up with additional scenarios of possible things Houston could face since September 11th? Obviously, before then, airplanes being crashed into buildings wasn't something that had been imagined.
What they were doing prior to September 11th was looking at the preparedness of the city in event of any type of disaster, whether it's nuclear, chemical, biological, and see the level of preparedness. And if it was determined that there was a gap someplace, recommend steps to fill that gap. What we've done is compressed the time we normally would have taken to accomplish that objective. Their goal remains the same. However, there's some sense of urgency to get all that done. That's why we're meeting on a more frequent basis now.
The,
How many times has the terrorism task force met since September 11th?
We've had about 8 meetings of the task force, and we started out with a macro assessment, brought in experts from Washington and elsewhere to talk about the strategic threat, the strategic terrorist threat, both domestic and international. And then we parsed it down to the threat at the local municipal level, the county level, looking at various coordination mechanisms, and therefore started with an overall strategic frame of reference and homing it down to Houston. So the task force has involved experts that we brought in from the outside of Houston, but mostly we're working with the various agencies that you see represented here in Houston.
point out to the AP reporter a minute ago too, she said that we hadn't modeled an airplane crashing into a building. We hadn't modeled into a high-rise, but we did model a 747 crashing into the chemical plants in the east end of the county and spreading a chemical plume. So those kinds of scenarios, while not terrorist-driven, were modeled by our emergency management office over the last few years on a what-if scenario. And so we go through a lot of the worst-case scenarios, and those have been reviewed. And in fact, the things that we have put together and the terrorist responses that have come together out of the county and the city as well are being modeled around the nation right now on the kinds of responses because of the emphasis that's been put on that in recent years in this community.
Yeah, our plan is called an all-hazard plan, which means either any man-made or natural disaster, our plan would accommodate all of that, any type of hazard.
For our purposes, it doesn't matter if it's a terrorist that drives the plane into the ground or an accident. It's still the same kind of response.
What federal presence is on the task force, if any, and can you name the members?
Right now, we do not have a federal presence on the task force at this stage. The task force is evolving, and our coordination will evolve. That when we get to that point, we'll go into the federal level.
Mr. Bassett.
I must state that what the mayor and Judge Eccles is saying, in our deliberations, I think one thing to remember about September 11th is that this was one of the most heinous terrorist acts using conventional instruments to achieve weapons of mass destruction results. Knives smuggled onto planes by terrorists, and passenger aircraft to achieve mass casualties. So that also has been part of our deliberation, as has been mentioned.
Described as a high-concept, low-tech operation, I suppose. Are we aware of any specific threat to this region now?
No, we have not had any specific threat to this area, and that has been the case ever since September the 11th, so we've not had any specific threat.
Short answer, if they unleashed something diabolical in the next 24 hours, is Houston ready?
As ready as anyone can be. I think we'll find we're probably better off than any other or most major cities. If anyone's ever exactly ready for any event that you don't know that's going to happen, that poses a different question, but we are as well prepared as we can be at this time. And we'll be even more prepared as we go through our process and seeing what else needs to be done.
Is there a deadline for finishing the report? I've heard everybody say accelerated, but does anybody have a good target date?
I think, as Judge Eccles pointed out, this is a long-term process in terms that the threat out there is going to be with us for a long term. And what we're going to do, we have certain phases of the report that we, as the mayor said, we've accelerated to draft the conclusions on that. And we're talking about a period of a couple of months. But it's going to be an ongoing process. As you can see, what President Bush and the strategy that our federal government is taking, that this is a campaign that is going to be a long-term campaign against the global reach of terrorism. So this is going to be an evolution, and we're going to have to fine-tune whatever instrumentalities we have in place. The world has changed on September 11th, and our priorities have changed. And the highest priority of any nation state, of any government, is the safety and protection of its citizens and its homeland. And that obviously is for our nation and for the city of Houston.
So those phases you mentioned, what's the first phase?
The first phase, as I mentioned, we have a draft summary that we're going to present to the mayor. That's been completed. We're going to go into the second phase of coordination along the lines I've outlined in my opening statement.
Do we have any indication that any of the financial backing of any of these organizations passed through any banks or organizations in this area?
We would not have access to that information. Let me point out that this is, however, an ongoing process. One of the reasons you hold drills is to determine, is there a means of improving what you are doing? So we'll always do something to improve what we're doing. That's the purpose of the training and the drills, to see if there's a better way of doing things. So you may discover one technique that's better than another, or you're doing something you shouldn't be doing. That's the purpose of having a drill, so it'll always be upgraded.
The ambassador mentioned earlier, along with sufficient funding, that sufficient manpower would be needed. Are there any plans on the city or county level to add emergency personnel from the fire department, police, or?
We have a plan to increase the number of firefighters we have, but that's been in place even prior to this. We'll continue doing that. Chief Cornelius put together a plan, and basically it's to have 4 firefighters on a truck. That's been the overall objective. We do not have that on all of our trucks right now, so we do have a plan for accomplishing that objective over a period of time.
Harris County, again, is not a first responder in the term of having police, fire, and ambulance. We are looking at how we might fill the holes in some of the hazmat areas, particularly in the volunteer areas, and provide relief and support for the smaller municipalities in partnership with the city of Houston. And that is an issue we're examining now. It's not a large personnel issue. Probably the biggest issue for the county in the medical response part of this task force is the trauma center location. Dr. Maddox from the hospital district has been very familiar with that issue from Ben Taub. And it really started before this issue came up. It was a response to Tropical Storm Allison and the loss of the trauma centers at the medical center and the inability to access the medical center because of flooding. A similar event could occur in the event of terrorist activities. And so we're looking at how we might establish more broad-based regional trauma centers. And that discussion came up beforehand, and that'll be part of the hospital district's budget, as well as working with the medical community and the other hospitals in this region, between LBJ and then areas in northwest, southwest, northeast parts of the county that might be able to absorb healthcare needs that this committee would identify.
One more question? Thank you very much.
Thank you. Again, sir, thank you.